that you hear about in a minute. But a couple of things first. To welcome you guys. I'm Candace Tanner. I'm the president this year. Trying to fill some big shoes, that Gwen Metatoff left last year. So welcome to everyone. A little bit about the league. That we've been in existence for over 100 years. Our particular chapter started right before COVID. We have about 87 members here and cover 8 counties. But our league, nationally, state, and local, is a nonpartisan organization. We've always been that. We neither support or oppose political candidates or political parties. We do, on this one, we are not apolitical, however, just because we're nonpartisan. We take a strong stance. Our positions, are available upon request, and you can get those online. But we thoroughly research a lot of the topics, the areas that you guys as citizens are interested in. We take a large variety of actions. It can be advocacy. It can be almost to the point of activism, as we protest here recently. But we also do litigation at the actual national level. And it's around voting rights, civil rights, and other issues of importance to you, in the public. We do encourage political participation by our members, however, even though we're nonpartisan. The educational program that you're about to hear, too far there. Today, is funded through the 501c3, that's the nonprofit portion of our league. The advocacy part is actually funded by a different mechanism, but these excellent educational programs that you've seen helps to empower you guys, to have the background so that you can fully participate. Now, upcoming events. Wanted to highlight a few here. Our very popular Lunch with the League is happening next time, in Elizabethton at the Black Olive. Dave and Gwen are hosting that, so in the newsletter, if you haven't signed up for it yet, please sign up at the back. But in the newsletter, it has Dave's email in there to RSVP. If you don't get an opportunity to RSVP, it's okay. Come anyway, but we try to have enough room for everybody to sit. Second that we've got here, and this is a new one here, this is the public announcement. It's going to happen on November 6th. The Women's Suffrage Coalition in Knoxville has worked very hard over the last few years to get a women's suffrage museum. The announcement will be made, on November 6th in Knoxville. They purchase a building. I think they close on it the day before, and then this public media announcement on the 6th. They plan to actually have the museum ready to open in 2028 during Women's History Month. Linda Good, who is a local celebrity, I think Gwen had mentioned in the newsletter, she was able to orchestrate the mural for women's suffrage downtown Johnson City. She has offered to try to carpool with anybody who might be interested.
We have a group of 5 going.
I'm sorry?
We have a group of 5 going.
They've got a group of 5. There's room for more.
Linda will be her wife.
Okay, she will be dressed as Susie Suffragist, okay? For this one, so I want to at least make you aware of that one, because it's a sister organization, very collaborative, and we're all about, women's suffrage for sure. The next one is, and apologize on this one because we have back-to-back meetings this time. It just worked out that way because of our excellent speaker availability and the facility, but it's next Sunday. Apologize for those of you who came last week who are used to seeing the 3rd Sunday of the month. I know you showed up and no one was here. But we are, Bob Warner has now, updated our calendar on our website. Just search for LWV-NETN. Search for that one and it'll direct you to our website. And the calendar, we're going to keep that updated with all of our things that are going on so you guys can stay informed in case we miss you. On that one. But again, apologize to those who showed up. But the next week will be a part 2, a continuation of what we're going to start today. You're going to see the groundwork laid today, the underpinning information to help you understand the issue, the policy. And then next week we'll talk about how that manifests itself here locally. So don't miss it. This is part 1. Next week is part 2. Housekeeping? Yes, sir.
By the way, daylight saving time ends.
Yeah, so
Next
okay.
Sunday.
Next Sunday. Yeah.
Next
So it
Sunday.
shouldn't be You should be
Extra
more
hours.
rested.
Okay, so we'll go with regular time, whatever the time is. It takes me about 2 weeks to figure out what time it is, but thank you for reminding me of that. Okay, housekeeping. We'll only focus the camera. We live stream this on Facebook. It'll be focused on the speakers, but if you have a very distinguishable voice, you might want to not ask questions because you will be recognized, listed on the live stream, as well as voice recognition patterns, right, and all that good stuff. But let's say we will also post on YouTube for those who can't watch it live. We have snacks in the back. Please help yourself to those refreshments. Lots of goodies, let's say, take home on the table there. Donations are always welcome, let's say, since about 1/3 of our budget is taken up, let's say, essentially with refreshments in the facility. But please take those things home. And again, next week on daylight savings, whatever the standard listed time is, we'll be here at 1:30. If you want to come and mingle, meet a couple of new people a week, we'd be glad to hear you and to have you. All right, with that, I'm going to turn this over to Ramsey to introduce today's speakers.
Hi, so I'm not going to take very long. Each of our speakers will briefly introduce themselves rather than me giving a long formal introduction. But I want people to appreciate that this is really important information, you're here because I think you know that. And both of them have knowledge about things that happen as a result of legislation and public policy that sometimes we don't always get the details about. We know a lot of people say they don't vote because they don't know how government affects them. Well, this will provide information about the local effects of, government's not out there or over there. It's in our lives every day. And so both of our speakers will be illustrating ways that is true in Tennessee today. Shana Watkins came in from Nashville from the Tennessee Justice Center. Vandy Kemp came in from Maryville, so both of them came long distance to present with us, and we're very grateful for it. So we'll start with Vandy. Both of them will give a brief presentation of some foundational information, and then after that, we will try to have more of a just discussion, pose a couple of questions, let them talk about it, try to get some, fleshed out detail about the information that's so important for us to understand. We'll start with Vandy. We'll have to do a quick technology changeover, and then Shana will present, and then we'll have the discussion. So thank you very much.
If somebody needs to holler at me.
Oh, that's
That'd be great, if you could let me know, what time is it right now, 2:09?
I'll set a stopwatch and then.
Okay.
That's okay.
So they just warned us about the court. Good afternoon, my name is Vandy Kemp, and I just want to say I've got a couple of slides that have quite a bit of text on them. I know that's a bad slide habit for speakers, but there's some things I want to share. So if you can't see back there, you may want to move up. But anyway, I'm so pleased to be here. Let me tell you a little bit about me. Johnson City for me is halfway home. I grew up in the foothills of the Blue Ridge Mountains near Roanoke, Virginia. If any of you are Blue Ridge Parkway fans, you may know about a little town called Floyd. I graduated from Floyd County High School. We still only have one stoplight there. It is like Mayberry, and I love it. So getting to Johnson City means I'm almost halfway there. I'm going to have a hard time heading home tonight. I'd really just like to keep going. I am a lifelong educator. I graduated from Radford University back when it was a women's college, Radford College, for educating teachers. And I started out life as a high school music teacher. Very quickly switched to school counseling, and then eventually decided I wanted to run things. So I went into administration in Sevier County, and also now in Blount County. About half of my career was in K-12 secondary education, and the other half was at Maryville College. I ended up as Dean of Students there. So it's given me an opportunity to take a look at the breadth of public education, not only in Tennessee, but across the country. And I did a really dumb thing 5 years ago. A friend said, you know, Bill so-and-so has been on the school board for 22 years and he's not running for re-election. And nobody has declared for his district. I think you ought to run. And I said, I've gone to 330 school board meetings in my life. I do not need to go. But I kept thinking, okay, this might be a last thing for me. I went on the Board of Education in August of 2020, and nobody had ever heard of critical race theory. Nobody had heard of book banning. Nobody had heard of a plethora of things that we ran into full tilt when I was on the school board. So, and we were also at that point when I ran, we were nonpartisan. I had never been in a position to declare my political affiliation before. I didn't think I really had a political affiliation. And all of a sudden I've got a big fat D. Because I had to. And that's a terrible idea that came up while I was on the school board. So I'm going to take you for a little bit of travels with me and my journey on the school board of what I learned. And also when we talk at the end, my opinions about how things are here and how you all may be able to get involved and show support for public education without running on the board. I'm not advocating that. So this is one of my dense slides. I put this in today because I think lots of times, how many of you are native Tennesseans? How many of you are not? Okay, pretty good. How many of you have been at some point in your life an educator, professional educator? I knew it. Okay. I know that all of us make jokes about rolling our eyes and saying, oh my gosh, I'm so embarrassed to be from Tennessee. Look what they've done now. We've done it, haven't we? Admit it? We have done it. Okay. What I wanted to quickly go through is to show you that in terms of public education, and irrespective of issues around desegregation and race in the 19th century, Tennessee has often wound up leading the pack on K-12 initiatives and progress. And I think sometimes we need to be reminded of that. There's a lot to be proud of here. So I'm going to run through this real quickly, and if you can't reach it, 1806. Our state was 10 years old, and interestingly enough, in the first Constitution, there was not a word said about education. In 1806, the state of Tennessee did provide for public education and said that every county, and I think at that point there were like 25 or so, every county had to build an academy, and the state would give the property for doing it. In 1835, they realized that maybe somebody needed to be in charge. So the governor appointed a superintendent and a board of commissioners. Sadly, they discovered that the superintendent was misappropriating funds, and Governor James Polk, who was governor then, had to sue him to get the money back. Little problem there, little setback. In the 1840s and 50s, there was some progress. There was some effort made to lift up funding and do more for public education, led by Governor Andrew Johnson. We sent a lot of people to Washington eventually, didn't we? All of that progress got tabled by the Civil War. After the Civil War, governors, people in Nashville said we got to get back on public education. We had to. We protected democracy by having educated people. However, we ran full tilt into Jim Crow and mandatory segregation, which paralyzed education for decades and decades and decades, and I'm not going to color that any more positively. However, in 1899, it took that long, secondary schools were provided for by the state of Tennessee in terms of funding. Up until that, it had entirely to do with the income level of the town you were in. 20s and 30s, things were sort of prosperous after World War I, more funding for education, and then we plowed into the Depression and even more challenges to segregation because the state of Tennessee had realized we're being expected to run two school systems here because we're separate and not equal. In 1838, there was a training, we could train teachers to be better teachers. 1943, I thought this one was interesting. That's the first time that the state mandated a hot school lunch program and provided money for it. 1954, of course, Brown versus the Board of Education. At 1960s and 70s, federal legislation came into play in the states. That really had not happened before. And so all of a sudden, we've got Civil Rights Act that mandates certain things. We've got Title IX for gender equality, and we have IDEA. IDEA is for what? Special education. And I think that was 72, 73, I didn't look up the date. But that meant that every child in the United States was entitled to what we called a free and appropriate educational placement. So nobody had to stay home anymore just because they had a disability. In the 1980s, things really started churning in terms of education and federal overreach. So Reagan published his people published a research called Nation at Risk, saying that collectively schools are not doing what they should be doing. Lamar Alexander stepped into that gap and came up with the Better Schools program, which eventually became, and for those people, raise your hand, said you've been an educator, if you're around in the 80s, Comprehensive Education Reform Act. Teachers and principals flipped that. Nobody had ever told us before what we had to do. Nobody had told us that there was going to be somebody looking over our shoulder to see what we did. And a lot of educators felt very defensive. I will tell you that part of the problem with educational reform that comes through legislative action is that when you're in the middle of it, you feel like you're in an airplane that's under construction and you're flying. And so Lamar Alexander's Better Schools program looked terrific on paper and kind of crashed and burned. But the Comprehensive Education Reform Act, some of you are not teachers heard of master teachers, career ladder, all that stuff came out of that. I was an administrator at Sevier County High School during that time, and I remember having an older seasoned teacher tell me, Vandy, I have not had a principal in my classroom in 15 years. Which was a little shocking to me. And not that I thought the principal we had at the time knew much more about anything than she did, but it was that total lack of accountability. And if you lucked out and had good teachers who took personal pride in their professionalism, you were great, but there were some issues. Now, what happened is so many of those things were not fleshed out. And so many of them, I mean, I can talk for hours about what happened to me with Career Ladder. I did get level 3, I made it, but it was difficult. In 1992, the Educational Improvement Act, another federal act, focused on accountability and capacity and the concept of value added. Now, if you're a teacher in this room and you were teaching them, that makes you shudder, because all of a sudden we were putting the responsibility for student achievement, in my opinion, irrationally on the shoulders of teachers. And if teachers did not add value to their students, like if I got a group of third graders and they were here and I don't get them up to here by the end of the year, it's a ding on me, and was a financial ding. So that was not a great idea. And then in the 2000s, everybody sort of laid off education during that, or after that 80s period. Barack Obama came out with the Race to the Top, which was the first time there was a competitive financial grant program coming out of the federal government. And the idea was that it was supposed to give local districts an opportunity to show their stuff, to go to work on it. Instead of just federal money coming in, you had to prove that you were willing to compete with others and be the best you could possibly be. And in a lot of school districts, it wound up being a very good thing. That was during the time 20 years ago that we heard a lot about Common Core. Common Core was controversial because the notion was all American children are going to be taught the very, very same thing. And so that got dumped in Tennessee, but what stayed were the concepts of Common Core, which had to do with curriculum reform. not teacher reform, not educator reform, but curriculum reform and teaching things in better ways. And then, in 2019, and I know you can't see this if you're in the back, so I'll tell you, Governor Haslam, he was sort of our second education governor. His administration had developed Tennessee Ready, which was by the time a kid graduates from high school, they're going to be able to either go to college, go into a trade, they will be ready when they leave our public schools. Nobody had taken that approach before. The focus was always on something else. And so if you can't see this chart, Education Next is a well-respected think tank that does extensive educational research as well as opinion formation. And they had taken a look in 2009 and 2015 and then 2017 at the growth in student achievement. And what I can tell you is, in 2009, Tennessee got Fs.
2.5.
Okay. In 2015, a B minus. And in 2017, we led the nation with an A. So, good things happened. And then, change happened, political change happened, and all of a sudden, what people were looking at in education changed entirely. And it was political, and we all know that, and that was in the last 5 years. So what happened? So I want to show you, briefly, the management structure of public schools, and I think most of you probably know this. Legislature enacts, amends, and repeals state laws. The governor oversees state agencies, including the Department of Education and the State Board of Education. They oversee public schools and provide guidance for compliance. Public Charter School Commission is also, that falls under the state. People don't know that sometimes, that charter schools are state schools. And then finally, the local educational agency is like Kingsport Public Schools, Blount County Schools, LEA. So that's where our boards come in. And I just mentioned the other two of those structure have to do with higher education. Notice that the legislature doesn't have anything to do with school management, right? All they're doing is looking at laws that come recommended to them, hopefully by professional educators, and enacting them or changing them or whatever. And we'll talk later, for many of us, that has gotten upside down. Okay, LEAs and their school boards. These are the only things that a board of education is responsible for. Hire and evaluate the director, adopt an annual budget. I know you're telling me I'm out of time. I need about 3 or 4 more minutes. Can I do that? Okay. Adopt textbooks and curriculum. I knew that history thing was going to get me. Represent public interest and adopt policies. These policies reflect state and local legislation. They may also originate with the board as long as they comply with existing state law. And that last one I put in bold. Most of the school policies, and I was chair of the policy committee when I was on the board, most local school policies at this time are being driven by Tennessee legislative action, not by local action. So what does this look like at the local level? Thank you. State legislature adjourns in the spring, right? They go home in the spring. The Tennessee School Board Association works with the State Department of Education to interpret all the laws they've made. Last year there were 60 laws about education, over 60 coming out from the legislature. It is a task. The local Board of Education gets from Tennessee, or the State School Board Association and their attorneys, here's how we think your policies should be written to make sure that you're complying with state law. That happens in July. And then in August, the Board of Education reviews all that and either tables it for another meeting or goes ahead and passes it, because at that point in August, we're flying the airplane. So if we've got new policy, we need to get it in there quickly. And so the district office takes whatever the board has approved and shovels it out to schools and principals. So what I wanted to do in this last 3 or 4 minutes is quickly move you through 4 bills. This won't be as detailed. 4 bills about books and about banning books as an example of state policy in the last 5 years that have tremendously affected local activity in local schools. So the first one was called the Prohibited Concepts Law. In it, in 2021, the state legislature said there are 14 things that you cannot talk about in your public schools. And I made a list, and I'll be glad to share these slides with you. I made a list, so I'm not going to go through them all, but it was things like you can't introduce a topic that suggests that one race or sex has been mean or mistreated another race or sex in the past.
You can't teach history.
Yes, right, or gender. You can't suggest anything that says, that implies that one race or gender is better or superior to another. You can't say that a meritocracy, like all the smart kids get to do this, you can't suggest that or say that it is, suggest that it is racist or sexist. You can't say the government should deny to any person within the government's jurisdiction the equal protection of the law. I put that in there because of recent things that are going on from the federal government. So that was the first law, prohibited concepts. You talk about people going nuts. Think about being a, 5th grade history teacher and trying to navigate the Civil War in Tennessee. Okay, number 2, the Age Appropriate Materials Act of 2022. This said that every school district must post every volume they have in their building on their website, so that in their library, so that parents can check it over. It said that there must be guidelines about how teachers and librarians select their materials. Let me say, all of this was not negative. A lot of librarians didn't have clear guidelines. And our district, because I was on the board then, came up with a really good, just a manual for you do this, and then you do this, and if it checks all those boxes. And if the book, the state said, if the book or material is consistent with the mission of the school and age appropriate, is it? And if it is deemed not appropriate, that book has to be removed by the Board of Education. Yeah, you define inappropriate for me. Third one, criminal offenses. The next year, the state legislature said, if I'm a publisher or a bookseller and I sell your high school something that somebody says is inappropriate, I can go to jail. That was 2 years ago. That law is still standing. And then in 2024, the end of 2024, the legislature realized that they were having trouble with defining that age appropriateness. So they made a list of things that books should not do. The one that was particularly interesting to me, having been an assistant principal in a large high school, is that a book cannot suggest sexual excitement. Mark Twain suggested sexual excitement. Okay. All right. If enforcement varies from place to place, and these numbers here, Monroe County has immediately banned 574 books, Knox County 113, Rutherford, where MTSU is, banned 185, Oak Ridge 320, Blount County, where I am, so far has only banned 1, and that was when our newly elected board president last year went into the library and pulled a book out and took it away. Those quotes are just about, there is growing opposition to this as people become concerned about, do we really want to ban To Kill a Mockingbird from our high school libraries and such. And we'll talk about my reflections later. Thank you for the exercise. And I apologize for the rush. Is that okay?
Yeah.
20, okay.
Okay, everybody can hear me. It pained me to have to tell Vandy that her time was running short because I was really enjoying the presentation. I just wanted it to go on and on. My name is Shana Watkins. I'm from the Tennessee Justice Center. And let me just clarify that to us, justice will be done when everyone has accessible and affordable health care. So that's the kind of justice, that's what we're thinking about when we think about justice. So we don't do family law or criminal law, it's just health law. We have a couple of different divisions, and the one that I work in is the health advocacy sphere. And I'm going to basically talk about, I think, 4 things that we are most concerned about when it comes to the state of healthcare in Tennessee right now, especially with regards to H.R. 1, otherwise known as the One Big Beautiful Bill Act, but also talking about the ACA, which is woven into that. It's all part of the healthcare landscape, but the part that Congress is battling out right now and is causing the shutdown is not strictly part of the One Big Beautiful Bill. So you all in this room, you all know why the government is shut down right now and what Democrats want and what Republicans want or don't want. So I'll kind of skip through that, but just please know that these slides will be made available to you. I'm going to give them to your leadership and they will send them out to you and you can use them in whatever way you want. They'll be in PDF form so you can't alter them, but I do just want to say, just for clarity, because there's been a lot of confusion around these two things, examples of major provisions of the One Big Beautiful Bill Act that do not apply to Tennessee are Medicaid work requirements. We're not doing that as far as we know. And then provider tax changes. So provider taxes is one way that a state helps pay for its Medicaid program. It got quite a bit of money from the federal government, and I think in Tennessee it was always around the, 60-something, mid-60% range, because it is all calibrated by GDP, but not trying to get into the weeds too much here. But with the One Big Beautiful Bill Act, basically what that does is says, okay, you're no longer going to get this much money from the federal government, you're going to have to pay for it yourself. Well, one way that they're tying states' hands behind their backs is to say, well, you also cannot use provider taxes. Now, Tennessee was already at the maximum number, the maximum percentage, which is 6% of provider taxes, so that's why it doesn't affect us. We were already charging the maximum amount. So those are the two things. Now, I just want to implore, please don't let anyone say Tennessee's not going to have it as bad as other states because we so wisely chose not to expand Medicaid. That wasn't a wise choice. I'm going to speak very frankly here, there are people dead today who would be alive if we had expanded Medicaid. And some of those folks are, among the most vulnerable of our populations. So just because we're not doing work requirements, as far as we know, and we can't charge more in provider taxes and therefore raise more money for our program, that does not mean that Tennessee is not going to be very adversely affected by these cuts. We expect that, let me just make kind of a segue here. I want to segue into talking about ACA coverage. So we do expect that a lot of families' premiums will double if, say, the Democrats folded right now and said, okay, we'll give you what you want, we'll reopen the government, and enhanced premium tax credits, we'll just let them expire. Now, as these 265,000 Tennesseans who are currently getting those subsidies, as they don't get them anymore and then are therefore uninsured, it puts our hospitals at risk, especially rural hospitals. We already have 9 in this state that haven't closed yet but are at risk. And at risk is defined as they've been operating in the red for at least 2 years. So they operate in the red because of uncompensated care. People flooding into the emergency rooms, and they have to treat those people, and those people have no way to pay for it. So medical debt goes up, and uncompensated care goes up. Medicaid is a real mitigator for those negative effects. And so once you don't have that anymore, or not nearly as much of that, then hospitals are really, really strapped to find ways to pay for that care. So that's 265,000 Tennessee families. Well, I will say Tennesseans, because some of them are a household of one. But another 46,000 Tennesseans will struggle to pay those higher premiums. That means that folks with chronic illnesses will just do their best to stay on. And that may mean, and will probably mean, that they have to decide to buy cheaper food, not as much food, or skip prescriptions to make them last longer, or just go without their prescriptions, which is an incredibly unhealthy thing to do and puts a lot of lives at risk. So these are the decisions that these 46,000 Tennesseans are going to have to make if these tax credits expire. The number of uninsured Tennesseans will rise by 39%. This chart shows you, this is from Kaiser, the Kaiser Family Foundation, which is pretty much the gold standard in Medicaid research. And this shows you how, since 2014, how many, this is just Tennessee, how many people have enrolled in the Affordable Care Act marketplace, otherwise known as Obamacare. So you'll notice that in the middle there, that's 2020. So a lot of people lost their jobs because of the pandemic, went on to TennCare, and then eventually came off of TennCare, and a lot of them went on to the marketplace coverage, and it has climbed and climbed and climbed. So just imagine that going in the opposite direction, essentially. Won't go over these too much, but just know that these two charts are here. They're also from KFF, and they show how much of a household's percentage of their income is going to go towards their health coverage, their premiums, if these tax credits will expire. This first slide is just an income, just a household of one, but this next slide is a family of 4. Okay, so just if you're a family of 4 and you're bringing in $40,000 annually, the percentage of your income that you will then have to spend on healthcare premiums is 2.1%. So it went from 0 to 2.1%, and that's an $840 difference. I think this speaks for itself. This will also be in the slides that I submit to you. But we have a letter already written. You can, of course, amend it, edit it, do whatever you want to it. But it basically just says, I'm one of the 70-something% of Tennesseans, almost 80% of Tennesseans, who want you to extend these tax credits because my neighbors are depending on it, my in-laws are depending on it, I'm depending on it, whatever the situation is. Now, I want to ask this group, and this is not meant to shame anybody, but if you would, just show of hands, who has heard about the part of the One Big Beautiful Bill Act that has to do with nursing home staffing standards? A couple of people. Okay, this is pretty standard. When I asked groups of about this size, which I was in Dixon County last Sunday and got the same response. The reason you haven't heard about this is because for some reason the media is not covering it. But, you're going to think I'm lying when I say this, but I promise you it is absolutely not hyperbolic. Towards the end of the Biden administration, they passed a nursing home staffing rule. And essentially what it did was I think I might have it on the next slide. No, essentially what it did was it said, we've got to have some standards around nursing home staffing because the quality of care that these folks are receiving is so abominably low. People are dying, people are suffering, People are becoming hospitalized due to dehydration because their call buttons aren't getting answered. So this staffing rule that the Biden administration passed says each resident of a nursing home will be required to receive, I think it's 2.5, or a little over 2.5 hours of personal care per day. I don't think that's unreasonable. Some people think that's pretty modest. And also an RN has to be on staff 24/7. Of course, it doesn't have to be the same RN, but there has to be a registered nurse on staff. Because sometimes nursing home residents, the only way they can receive hydration of any type is in a way that has to be overseen by a nurse or a physician. So what the One Big Beautiful Bill Act did in what one of our founders calls an enormous gift to the nursing home industry or nursing home lobbyists is it says, remember that staffing rule that Biden was going to pass? We're going to put a moratorium on that for 10 years. Why 10 years? I don't know. I don't know. It's just especially cruel. So again, not being hyperbolic when I say if you or anyone you know thinks that they may go into long-term care in the next 10 years, you have grave cause for concern. We all do. And I guess what I could suggest is that you should be having a conversation about this with everyone you know, but especially brass tops elected officials like county mayors, county commissions, and certainly our legislators. I've talked to a couple of legislators who don't appear to have any knowledge of this at all. I'm not saying they don't care, but they don't seem to have any knowledge of this at all. I mean, again, this was a big bill, a very big bill. It's even in the title of it. And it was big so that some things would fly in under the radar and be completely unnoticed. I know that sounds really cynical, but that's, as far as I can see, just the fact of the matter. This is one of those things. So we know that lack of staff in nursing homes has been implicated in, and this is decades of research, into dehydration, malnutrition, bed sores, outbreaks of infection, not to mention depression and despair among nursing home residents, but I also want to spare a thought for folks who work in nursing homes. It can often be a very toxic employment environment because they're understaffed, and when you're under that much pressure to provide empathy and compassionate care, and you are not getting that yourself, and you're not supporting each other and the staff because you just don't have enough people. People in the laundry are being told they must respond to calls even though they don't have that training. And yes, that's a story I actually heard from a friend of mine in Bledsoe County. That just doesn't bode well. Also, that's going to create a bunch of turnover, and these folks are developing relationships with these people who work there, and if they would stay in their jobs, that would be better for everybody too. I've also included this slide, which is from the Tennessee Justice Center's website. We have a data dashboard, and you can look at your own county and see what the uninsured rate is. You can look at other things like demographics and public benefits. You can look at economic stability and nutrition. I won't linger on that too long. But also the Sycamore Institute, which is a wonderful Tennessee data source. They do awesome work. Very, very nonpartisan. They have this really, really good, I think this is on the very front page maybe of their website right now, but they have, I picked Washington County, but they have how many enrolled in TennCare, how many enrolled in supplemental nutrition benefits. So the second half of that at the bottom is SNAP benefits. So you can see, you can hover over your own county and see what the demographics there are. Another thing that we're really very concerned about, and I'm sure that you are too, is this Rural Health Transformation Program, or Rural Health Transformation Fund, it's been called. Now, my observations from state legislators is that this is being sold to them as a cure-all for all of the Medicaid funding that's going away. Oh, that's okay, we're giving you rural transformation funds. And they're super excited about it. Like, they can't wait to tell you about it. It's awesome. I would just respectfully disagree. The math doesn't work, for one thing. You're gonna take $1 trillion out of Medicaid, and then you're gonna replace it with $50 billion. That $25 billion of that will be distributed to every state equally, regardless of your rural composition. So that means that Massachusetts is getting the same as Tennessee, is getting the same as Wyoming, is getting the same as Florida, is getting the same as California, as big of a state as it is, or Pennsylvania or wherever. The other $25 billion is discretionary grants. And the states are hastily submitting their plans to CMS to see if they get that funding. But again, it's discretionary, which means that Dr. Mehmet Oz is basically going to be who decides who gets grants and who doesn't, which states get how much and whatever. The implications there, I think, speak for themselves. But there's also there's no performance accountability that's required, so we're worried about the reporting that states have to do. They just get the money and they can use it however they want. That's kind of how it's looking. And also, state legislators have to keep in mind, the states are getting the money, not the rural health providers. So we're going to have to track that money. I'm assuming that Tennessee will get it because they're looked upon pretty favorably by this administration. So if we get some, we're going to have to track that money and make sure that it's going to actual rural programs. That's a huge concern of ours, that it will just disappear and it will not be accounted for and they won't be transparent about how it's being used. Now, just really quickly, the Tennessee Justice Center has a whole team devoted to anti-hunger advocacy. And I know that this is really on our minds right now. If you opened up Politico or USA Today or really any trusted news source, probably one of the first stories you see is going to be about SNAP delays. And this is just a huge concern because even if the government reopened right now, or if the government or Tennessee decided that it was going to use rainy day funds to fund, to take care of these folks who are depending on SNAP, then it would take weeks to actually get that money and get the benefits to the people.
2 minutes.
Okay, thank you. So I have here on this slide, District 1, how many households in this district are on SNAP, or how many total number of households, how many are on SNAP, how many participating individuals, how many workers in those SNAP households with elderly members, and those could be, just a household of one elderly person or one senior. Households with children, that's 47 of the SNAP participants in this district, and then SNAP households with disabled people inside of them. And then the median household income for those SNAP participants, it's $23,000. That's the median income for these SNAP participants in this district. So when they're not getting their SNAP benefits, where's the food going to come from? And my question right now, and I hate to be the raven of doom, I'm sorry, but my question is, or a deep concern, is about these food banks. Food banks can only provide so much food for so long. So what can we do right now to support them on top of all the other things that we're doing? So I do have some calls to action here. Our anti-hunger team has put together this appeal to legislators, and you can sign on to that too if you feel so inclined. But I would also invite you all, TJC hosts several calls per month, and some of them are quarterly. This one is just for SNAP access. Anyone is invited to it, whether you are a beneficiary, a caseworker, you work at a food bank and you want to, give your 2 cents and you want to have a voice in this conversation. So you would contact my colleague Owen, who's just an incredibly wonderful, empathetic person, and he will add you to the list and you'll get information about how to attend those calls monthly. They're at 10 Eastern Time on the 3rd Thursday of each month. A lot of other information in here about how these things are going to affect us. We can always come back to these slides. I'll just kind of keep them up here in case I need to come back to one, if that's okay. But thank you all for your listening and your participation and your attention today. It's my pleasure to come talk to you all today. Thank you.
Thank you both. Is this working? You have this? Thanks. Okay. So if you guys will sit down, we'll have a little bit of a structured conversation, but please feel free, as I said earlier, to mention anything that you believe is of significant import that you haven't had a chance to do. So thank you both for important factual information. So I just want to give you each a chance before we go into anything else to hone in on one particular aspect of what you've covered or what these topics are that you'd like to expand on just a little bit. So, Vandy, do you want to start? And there's the lapel mic.
I want to, it's difficult to talk to you about what I talked about, and then have somebody who's talking to you about people may die in the next 3 months because of what's happening at the federal level. So, all of this is dire, but I want to tell you why I think the public school issue, and I want to bring it back down to local in Tennessee, why it is so important. If I wanted to undermine a culture or a society, there are two institutions I'd go after. One would be religious institutions, and the other would be public education, or whatever education is going on. So the thing that is hard for me to watch now that I'm not on the board is that teachers are terrified. Teachers can lose their licenses. I didn't even get into what the ramifications are if you violate some of these laws. I was with a teacher yesterday at a library event, and I told her what I was doing today, and she said, tell them that everybody in our English department at our high school has taken their libraries home. All of their classroom libraries. And we know that there's a connection between classroom libraries and reading and deeper level thinking. So I want you to see these are two sides of a very similar problem right now for us, is health and safety and what's happening to our younger kids.
And I would just add to that, we all know that an enormously important, significant component of a healthy community is a library and schools that are educating freely. I guess what I would say is you cannot underestimate, and I know you all probably hear this a lot from a lot of advocates, but it does not cease to be true. One huge powerful tool that we have is our stories. It's very difficult for people to ignore your story if you're saying, like someone said to me right before this event started, my son-in-law may not be here today if it wasn't for the ACA. I mean, we all have a healthcare story, or we know someone who does. Share those stories. TJC has a way to collect those, but so does Tennessee Healthcare Campaign. And some other organizations too, but please don't discount the power and the effectiveness of your stories.
Thank you. Do either of you see, you're both talking about legislation that has already occurred. Do either of you see things that are like pending or under consideration that you think people should maybe read more about or become better educated about in your two areas?
Yes, and then I can give you a whole list, and I'm not going to take time to do that. But what I will tell you, for example, I'm going to turn this into a plug as well. I'm going to stand up because I see people back there that can't see me. I have become affiliated since I left the Board of Education with an organization called Public Schools Strong Tennessee. It started in North Carolina. And has come over the mountains to us. I don't know, I was going to look and I didn't. I don't know if there's a chapter here, but it is a nonprofit who's doing exactly this. Taking a look, paying attention to what's going on in Nashville, as well as Washington, but also finding out and identifying things that may hurt us down the road that we need to be paying attention to. Right now, our group in Blount County is getting ready, we're poised. If Governor Lee brings back the right of schools to not enroll the children of illegal people. There is no such thing as an, yeah. But if, and that got pretty far in committees last spring. So we're watching it very carefully, and we're all poised with school board resolutions to ask our boards of education to say to the legislature, this is bad, those children have a right to go to school here, we want to do that. That's how we held back the voucher. I didn't even get into vouchers with you. The voucher program for a year was getting school boards to say, no, this isn't the right thing to do. So yes, and I think all of these, EdNext, all these organizations are paying attention to it. And if you have any inclination towards supporting public education, I suggest you plug into a group like that. Go online and read what's coming up. I don't even know how to answer your question because there's a tidal wave.
I would just say it's very, very important that we, and I know this is easier said than done, but it's very important that we, the most important thing we can do is convene with each other, and you all are doing that right now, so you should pat yourselves on the back. It's so, so important that we convene, even online, but especially in person. And we need to make sure that we're encouraging each other and that we're not losing hope, because some of these things, you know, like the nursing home staffing rule, well, that's a done deal. That's been passed. There's very little we can do about that now. But I think that educating communities and elected officials about that, I mean, how can that stand? How can anybody with one shred of compassion, I mean, just a shred, how can anyone let that go on? So if we're talking about it enough and we're putting enough, I mean, even just talking about it to them is putting pressure on it, or on them about it. So continue to do that. Don't lose hope. If you ever need kind of a shot in the arm because you're losing hope, you have each other, but you also have TJC. Please reach out to us, and let's table it. Let's talk about it. Let's continue to just keep the conversation going, because that in and of itself is an act that's a very important one.
So, even Vandy, you alluded to some of what has happened, despite some adverse consequences, some of the consequences being somewhat reasonable. And based on what Shana was just saying about not giving hope, where do you find hope as we think about public policy, as we think about moving forward in healthcare and education for our local communities?
I said to them before the meeting started, I love to look at data coming in. For example, Vanderbilt University has very robust data about what Tennesseans think about educational and healthcare issues. And I love to look at the data because my sense is that a minority of Tennesseans are driving the train right now, and with a lot of outside influence, and making decisions about things that most of us, and I'm not just about us, because the league, you know, people say we're an exclusive club, but the majority of Tennesseans don't agree with. And so I think I find hope in looking at that. I find hope in gatherings. I find hope in talking to people that don't agree with me and having a conversation about it. Another group I would endorse is an organization called Braver Angels, which trains community groups on how to have conversations across the aisle. People, we have got to get America back together again. And if we're not talking to each other, that's not going to happen. I'm too old. Yeah. And so that gives me hope when I sit down with my good friend Patsy that I made because she confronted me after a League of Women Voters meeting and said, I thought you all were nonpartisan. And she and I are now besties. There's a lot of stuff we don't agree on, but we agree on those big principal items. So I think it's looking at data that's accurate and representative and connecting with people and talking to them.
I can absolutely not improve on or add anything to that answer because it was so perfect, but one thing that is running through my mind, and this is, forgive me for being kind of kumbaya, but I take a lot of comfort in art, and I'm talking about the comedians, the musicians. This is an extremely musical state. We take great pride in that, and we should.
Bruce Springsteen.
Bruce. Right, we'll forgive him that he's from New Jersey. But that's a great example. I wasn't even thinking of him, but that's a great example. There are a lot of them who are really, like Bruce, very well respected living legend artists. And they're speaking out. They're doing what, in my opinion, needs to be done. But even, I had a lot of time to kill before this event today, from when I had to check out of my hotel and then be here. So I went downtown to this little coffee shop called The Moon. Is everybody familiar? It was just it was like exactly what I was looking for. There was so much art on the walls. There were people convening and families coming in and out, and a guy there with his dog and his laptop. I think just being in convivial atmospheres like that, where people are being so kind to each other. Everyone there was so kind. And I just took notice of that. That really lifts my heart, and it makes me want to work harder for everyone, but especially the most vulnerable of us.
Thank you. I think I'll use what Vandy said about exploring data to put a plug in for our program next week, when we will be looking very closely at the opinions using well-designed survey research of Tennesseans on a variety of public policy issues, as well as experiences related to things like health care and food security and things like that. So we will present some data that's generated here in Johnson City about our particular region, the rest of the state, and the country as a whole, and how we stack up. And you will see some of the things that Vandy mentioned that are also in the Vanderbilt poll, which is there are areas of significant agreement that are shared across citizens of Tennessee. And I think looking at that data and understanding what we can take home from that will be important, as well as looking more specifically at the effect of the Age-Appropriate Materials Act that Vandy introduced on teachers and librarians, the actual people delivering education to our students. So next week will be a follow-up on that. So,
Can I say one other thing real quick that I want to clarify? I told you in that list, that quick list I showed you of school districts and how many books they've banned, and I said Blount County hasn't banned any. But then I told you that all the English teachers at one of our large high schools has taken all their books home. There are ramifications that may not directly connect with the law itself. There's an awful lot of fear out there and anxiety over both these issues. And it just is important to pay attention.
thank you. So if you had the ear of a legislator or policymaker, what would you hone in on? What would be your primary focus about some of these legislative or policy decisions that are being made and affecting Tennesseans?
I am so tired of public educators getting beaten up on. I know all of us had a bad teacher at some point in our career, in our lives, but overwhelmingly Tennessee teachers are qualified, they're well prepared. Nobody goes into that line of work for the kicks. And it bothers me that politicians are now creating policy and educational procedure without any background in public education. Just because we all went to school doesn't mean we know about how to teach or how to educate people. So I know that sounds trivial, but just backing up teachers, do you know how hard it is getting to hire a teacher? People are leaving the profession in droves, and it's because they're tired of stuff coming at them that makes no sense to them. And so, yeah, that's kind of overly simplistic, but be nice to Teacher Day.
underscore that. I'm a former educator, so
Okay.
underscore that. One thing that in my wildest ambitions, I would really, really love for Tennessee's legislators and all elected officials to understand who is actually on public benefits. We find that people who can work do work. They're not people who are trying to mooch. They're people who are just trying to make it to the next tax bracket so that they can get off of the benefits and the benefits cliff. It's not an easy life. It's, at the end of the summer, I was in Bledsoe County for their back to school event, where people can come in and get free school supplies for their kids. And I drove up to the school, and it was at Bledsoe County High School, I think. And I drove up to the school. I think the event was supposed to start at 9, and I was there at 8 to set up. And there was a line that had already started. And my friend who was with me said, there are already people lining up. And I said, yes, this is what it's like to be poor. You stand in line for everything. And then the time that you're not standing in line for something because you're so afraid that your kid's going to be the only one there with no backpack on the first day of school, you're just doing everything to prevent that from happening. The time that you're not there, you're at work, or you're just trying to spend some quality time with your family. That's who really is on public benefits. They don't want to be, they're not making a plan to do it, but it's there to save people. It's a safety net. And I really, really wish that more people in Tennessee, and especially in the legislature would, I think they do know it, but I need them to acknowledge it and start governing for those people too. Instead of using it as a campaign issue, to rile up division.
So if members of our group were to meet with a state legislator or policy head, how do you put that as a conversation point, not to be confrontational or antagonistic, but to start exploring the issue in a way that will lead to a productive, so could you frame that, just one question or discussion point? If you went in to talk to a legislature, how do we start that conversation?
I think you just tell a story. I mean, not a lie, but you tell a story about a neighbor or someone you've worked with or yourself, and then it's just two human beings having a conversation about something that happened to one of them, and the other one might be able to help them do something about it. It doesn't put anybody on the defense. It's not offensive in itself. It's just, this is something that's happening, and that's the only thing you need to start with as far as healthcare goes. Yeah.
I think it's important to, and education is different, that there's a local governing group. And I would encourage all of you, even if you don't want to go hang out at board meetings, I know back when we had a league, we would divide up the governing groups and we would go, and that's important. It's good for them to see you there. But show up at a school board meeting occasionally. The public school strong stuff, we've got a public school strong teacher. We go to board meetings and people say, you just got off the board, why are you back again? And I say, because I support public schools. So go and show up, but build relationships with local politicians. The thing, I haven't had a lot of luck talking to folks in Nashville, and I've had zero luck talking to people in Washington. But I've had luck talking to commissioners and school board members and building relationships with them that cross party lines and convincing them that maybe there's a different way to look. Because here's the thing, there's a direct line between those local politicians and state politicians. And if I can convince somebody in Marable or Alcoa or Blaine County that there's a different, better way to look at this, I send them off. Make sense, maybe?
So we have just a few more minutes. I'd like to give each of you a chance to wrap up or close or make a concluding comment. Because of limitations of the microphone and reaching people, we're not going to take questions from the audience this time. We're still trying to figure out a good system for that. but I hope both of them will feel like staying for a few minutes. If you want to come up and ask a specific question, we certainly don't want to limit you getting the information that you feel like you need. And so I'd like to take a few minutes here and give you whatever time you'd like to make concluding remarks. And we do appreciate you being here.
Thank you all for having us and for thinking it's important enough to come out and think about this. I think I want to tell a story. That's what I'm taking today. So, while I was still on the school board, a parent at one of our middle schools filed a complaint under the new Prohibited Concepts and Inappropriate Materials Acts against a book that was part of the core, what do they call it, the anchor text of a particular unit on diversity and inclusion. Remember back 3 or 4 years ago when we could talk about those things? The book was a Newbery Award winner called Dragon Wings by a Chinese-American author named Lawrence Yep. It's 40 years old, well known, and Mr. Yep wrote a series of books about Chinese immigration into America, starting back with when Chinese immigrants came to build the railroad, and then they gravitated to California, and this particular one I think is about 4th in it. But it is an excellent book for 6th graders in a place like Blount County schools who've had no exposure to Chinese people or those traditions, and who are struggling with how do you get along with people who are different from you. The father who brought the complaint against the book, the teacher had sent the book home for the kids to read at his school, was disturbed because in the book, the little boy's grandfather has been lynched by a white mob, and his family are terrified of white people in San Francisco. And his grandmother refers to them as white demons. You want to light the fire under a conservative, right-wing Christian person, you go around calling Americans white demons. Now, in taking it all apart, they explain that demon means entirely something different in Chinese culture. It's part of the hierarchy of things and spirits and so forth. But the father said, we will not have a book in our schools that suggests that Americans are demons or devils. And so he filled out the complaint form, and off it went. We were the first complaint filed in the state of Tennessee. And Penny Schwinn and the Department of Education found in our favor and said that there was nothing in that book that denigrated or all those things, those things that you're not supposed to do. But here's what happened. Our county administrators got so freaked out by having a complaint filed, they pulled all the books from all the 6th grades and all 4 of our middle schools. Part of them while the kids were reading it. It's that kind of fear that I want you to be aware of. And anyway, the best way to show your support and know what's going on in schools is to go to schools. And not just basketball and football games. But I know my church is very involved in putting readers in schools. And we have about 38 people that go in once a week and read to kids in our county schools. Easy thing to implement. I can tell you if you called up your local district and said, do you have some program where we can come and read your kids? They'd fall all over themselves. Find a way that you can engage in either this problem. For example, we're going to have a serious food bank problem in November, I guess. A lot of organizations that you and I are involved in, like churches and other nonprofits, donate money to Food Connections. Go home tonight and think about one thing that you or that group can do to help. And that's how we begin to change things.
Thanks, Vandy. I will say, I think I might have a way to kind of bring together both issues. I guess it was about a couple of years ago, I decided that, now part of my job at that point, before I moved into this position, was to do outreach to schools. And one of the things I created is an award. It's really just a recognition. It's not a cash award or anything, but it's called the School Health Hero Award. And it can be a crossing guard, a counselor, a principal, lots of school nurses, or coordinated school health director. So I just reached out to all of the people that I had connections to at schools, and I said, will you nominate a peer? So I, even in my present position, when I kind of moved over to a different team in our organization, I kept it because I still feel like it's really, really important to recognize those folks. So it gives principals and coordinated school health directors and others a chance to say to their peers, I see you, I value you and the work that you're doing to keep children healthy and safe. So maybe that's just one small part, one small way that we can reward people in the school systems who are getting beat up on so much all the time in ways that Vandy has described and that you all know. So, plug for School Health Hero. If you know somebody who works in the school system, they don't have to be specifically a school nurse or somebody who's directly, like obviously related to school health, because they're all contributing to children's health. It could be a teacher, it could be a social worker, it could be a crossing guard, it could be a coach. Anyone, if you know someone that you'd like to nominate, I'm always taking nominations for that. And what you can do is you will be able to, I'll interview them in a very informal way. It's just a phone interview. They don't have to be really intimidated by that. It's just a conversation that I record and I type it out. And then that will appear in our newsletter alongside a picture of them. And then you can click on a link to see the entire interview. So, that's my plug for the School Health Hero. Yeah, I have heard some amazing stories from some extremely humble people, and some people have refused their nomination because I think it's just because they're just too humble. So I try to talk them into it, but I don't want them to feel pressured. But that is a standing invitation. But I do want to thank you all for having us too. Thank you so much for your attention. We so appreciate it.
Sure.
I got another idea.
All right.
Which that made me think of. High school students want to get involved in all this stuff. So invite some high school students to come to a meeting and talk about what changes are they seeing, either at home or in schools as a result of all this.
Okay, let's thank our presenters one more time, guys. This is the kind of program, I said thank you to the program committee. You guys did a fantastic job on this one. And as Ramsey mentioned previously, the speakers will stick around for a little bit. Unless if you want to go ahead and ask them personal questions. But again, please take food. If you want some food there, let's say take pens, take buttons. We will make this information available. To everyone here. We'll get it out to you. With the slides, that both Vandy and Shana have presented today. If that's okay with you. Yeah. So again, let's thank them one more time.
Come back.
Yeah, come back next week, please, for part 2. Okay, let's really get a seat. For those of you who are data junkies like me, please come back next week. Thank you, guys.